Okay, hello everybody. I just want to quickly run you through the neurological assessment in your UK OSCE exam. All right. I've already mentioned several times that your assessment station is not going to be the same as someone else's assessment station because there are different conditions that everyone might be asked to assess. All right, and one of the assessment stations is subdural hematoma. There are others like you can have assessment on a patient who is asthmatic, someone who has chronic heart failure, ectopic pregnancy, falls and fracture, etc. I mean, they are all literally like the same kind of assessment where you assess the patient for 20 minutes and then you do the news 2 chart, like you record your vital signs on the news 2 charts. However, the neurological assessment station, the neuro assessment is usually done in, if your question scenario is about subdural hematoma, that is the only OSCE assessment station that will require of you to use the GCS. All right, I've tried so hard. I wanted to get the camera closer, but I don't know how to do it. But I'm sure you may have to zoom in to see what exactly I'll be doing on here. All right, so in your subdural hematoma, that's the only station that only assessment station that you will not be given a news 2 chart. You will only be given your neurological what do you call it? This paper, all right, which has everything, including where you even record your blood pressure, your temperature, everything. So everything in the news 2 has been brought onto this chart in addition to other things you may have to assess the patient in your neuro examination. All right, so that's out of the way. I am not going to do the entire 20 minutes subdural hematoma assessment. Okay, I'll do a separate video on that, but for now I just want to run you through the difference, as in, I'm sure I've already done assessments on my page already, where you do the news 2 chat and everything. Literally everything I did in that assessment, or everything that you have to do in an assessment, you will do it in this station as well, in subdural hematoma. But the only difference is that you are going to add some few things I'm coming to share with you today to the ones you already know. So the way you go about your assessment in every assessment you've done in the, like, asthma, falls and fracture, every other thing is the same thing. Just that if you get subdural hematoma, add what I'm about to teach you right now to it. Okay, so it's the same thing, just add this one to it. Okay, all right, so basically I'm just going to run you through the few details that you need to add to it. So the for neuro assessments, they will expect you to assess the patient's eye opening, the patient's verbal response, the patient's best motor response. They expect you to assess the patient's pupillary reaction. They expect you to assess the patient's arms and limbs, if they are, the power or the tone and everything is okay. That's literally the other thing you're going to do in addition to the normal assessment you already know. Okay, so let's just get right into it. So for the assuming you've done everything, you've done the blood pressure, every other thing, now you're about to start the neuro examination. So you can start like sequentially so that you don't miss out on anything. So you can do eye opening, motor, verbal, and then arms, in that order, so that you don't miss out on anything. Good. So for the eye opening, basically all you're going to ask the patient is that I mean, you've been communicating with the patient has been looking at you, blinking the eye, opening and closing the eye spontaneously. So obviously the patient's eye opening is spontaneous. Okay, so that one, there's nothing really you need to do. You just need to verbalize that, oh, okay, Akins, since I've been here, you've been communicating with me and I've been observing your eye opening is very spontaneous. You are blinking, you are doing everything normal, and so I can confirm that your eye opening is spontaneous. Basically that's it. And then you just write a 4 beside the spontaneous. So for eye opening here, I'm just going to write 4 here, because spontaneous is equivalent to 4. Okay, so just write 4 and that's it, basically, right? Then you move on to the verbal response. So the verbal response is basically where you ask about the patient's orientation to time, place, and person. Yeah. So you're just going to ask the patient, oh, and maybe Akins, please, do you know where you are right now? Then, and most of the time, listen, most of the time in subdural hematoma, the patient is likely to be confused most of the time. All right. So the patient might respond, oh, I think I'm in my garden, or I'm in the market or something like that. And like I told you before, for assessment stations, you are always going to have a live actor, a live person who is going to act as a patient with that condition. So they've been told exactly how to communicate with you to get you to do the correct assessment. All right. So usually for the verbal response, you would definitely have the patients responding, different, to symbolize that he or she is confused. Okay. So if you ask, do you know where you are, and the patient says something else other than the fact that he or she is in the hospital, the patient is not like well oriented, to place. So what you do, don't just acknowledge that and that's it, or reorient the patient to time, place, and person. Okay, so like if the place, he is not aware of where he or she is. Oh, okay, Akins, sorry, I think you were just a bit confused, but right now you are in the hospital with me, so just so you know, you're not in the garden or anything like that. Just reorient the patient to place. Okay, if you ask the patient, do you know who I am, and the patient cannot tell you that, oh, it's his or her nurse, then obviously the patient is confused. If the patient cannot tell you the date or the time of the year or anything related to time, then obviously the patient is confused. So you reorient the patient and then you document. And for verbal response, the confused part of it is 4. So you just write 4. You just write 4 beside the confused. All right. Okay. Good. Now you move on to what do you call it? Best motor response. The best motor response. So that is where you are going to ask the patient. So basically, it's about motor response, like movement response. Yeah. So what you do, the first thing you do is that you ask the patient to can the patient lift their eyebrows. Okay, so I lift my eyebrows. Okay, good. Thank you very much. Can you please stick your tongue out? The patient will stick their tongue out. Okay, then you ask the patient, can you please move your tongue from side to side? The patient will do it. Okay, yeah, good. And then that's it. And then the last part of it, of the motto, is that you ask the patient to stretch their arm out one at a time. So the patient will stretch one arm out, and then you ask the patient to squeeze your hand. So you are there, you ask the patient to squeeze your hand with maybe their left arm. He or she does it, and then can you squeeze my hand with your right hand? The patient will do it again, and then you ask the patient to use both hands to squeeze your hand. And then if you think the grip and everything is okay, then of course the motor response is okay. So you're just going to take or write 6 for best motor response. That means that the patient obeys command. So you just write 6 there, and literally you are done with that part of it. Good. Now the next part is what you call the pupils, where you are going to assess the pupillary reaction of the patient, like the pupils of the patient. So what you do is that you can tell the patient, okay, Akins, can you please focus before then there are some pre-questions you need to ask the patient. Baby Akins, have you had any surgery on your eye? The patient will respond, have you had any cataract on your eye, cataract condition on your eye or something like that? The patient will respond, and then you can ask the patient whether the patient has any contact lenses on the eye. The patient will respond. So those are like pre-checks before you do the pupillary reaction. Okay, so after you've asked the question, then you give some instructions before you start with the you start throwing the light on the eye. So you tell the patient that, okay, can you fix your gaze maybe on the tip of my nose, okay, or no, on the tip of my nose, or can you fix your gaze on my forehead, okay, while he or she covers one of the eye with the hand, and then you assess the uncovered eye, and then the patient will do vice versa, and you assess the other eye, and then the patient drops the hand and you assess both eyes together. Okay, so you give that instruction so that the patient can follow through. Okay, so now I've finished giving the instructions. All I need to do is, okay, Akins, can you fix your gaze on my forehead, please? All right, so Akins will do that, and then I will and can you cover your left eye? Okay, I have done that. So you throw the light, they will give you a pen torch. Okay, so you throw the light from the outer to the inner canthus, okay, and then you observe if it's reactive or not. Then the patient will do vice versa. You throw the light from the outer canthus to the inner canthus, and then you observe if there is reactive or not, and then the patient drops the hand, and then I'll do it all across. Okay, and I can you confirm whether the patient the eyes are reactive to light or not. All right, so according to the chart here, according to the chart here, it says that so you have a portion for the right, you have a portion for the left, and then it asks you about the size and the reaction. So for the right one, the size, usually the sizes are written in your question. You see it on the chart. You see the dots that you see here are usually the size that you are seeing when you throw the light on. Okay, so for the normal is usually 2 and 3. Okay, so obviously the patient is not going to have any unequal unreactive light, or it's a live patient. Yeah, so you can just write that the size is 3. Let's say 3, you write 3 here. Okay, and then the reaction, you just write plus sign, because the instruction here is that if the eyes react, the symbol should be plus. So I write 3 plus, that's for the right, and then for the left I write another 3 plus. I'm done with pupils, and basically that's it. Okay, then the last thing quickly is your limb movements, the limbs. You're going to assess the power in the limbs. Okay, so you do the upper limbs and then you do the lower limbs. So before you do that, you have to ask the patients pre-checks, like pre-questions, like we did for the pupils. Okay, maybe Akins, you find out from the patients whether they've had any surgery on their arm, whether they have any pain in the arm, because you don't want to aggravate someone else's pain by your assessment or anything like that. Okay, so you just ask the patients please, have you had any surgery on your arm? The patient will respond, what do you call it, do you have any pain in your arm? Okay, the patient will respond. If you are satisfied with it, then you can go ahead. So what you usually do is that you ask the patient to stretch one of the arm out, like the right arm, the left arm out, and then you tell the patient you're going to apply pressure. The patient should resist you while you apply the pressure. Okay, so okay, Akins, can you stretch off and stretch out your left arm? Okay, so I have done that, and then you the assessor, or you the person doing the assessment, will apply pressure, and you see I am resisting, so it means that the power in my left hand is okay. All right, you do the same for the right. Okay, can you resist my hand? Okay, and then the patient resists it, and that's it for that one. And then you ask the patient to stretch both arms, and then you put pressure on the two, and then you see if the patients can resist both arms all together. All right, basically that's it. And then you do the same for the legs. You ask the patient to lift the leg, and then you apply pressure. You apply pressure on both legs, and basically that's it. Yeah, so that's for the limb movements basically. So the same thing like we did for the limb movements for the arms. It says that it has the various characteristics they're expecting you to see. Yeah, so If both the right and the left are normal power, all you do is that where they've written normal power, just write R slash L. R slash L means that both the right, R standing for right, L standing for left. R is R and L, or right and left, both have normal power. That's it. Okay, so you just write R slash L against normal power. For any strange reason, if you find a patient that maybe has less power in the left and right and good power in the right, depending on that, it means you're not going to do R slash L. You're going to say, maybe if the left had normal power, only the normal power, you're only going to write L. You're only going to write L, but maybe the right was weak, or there was some mild weakness in the arm because maybe you were trying to resist and it sort of fell or something like that. So there's a mild weakness, so you can write just R against the mild weakness. Okay, but usually, I mean, anything can happen, but that's actually how it is done. And then you do the same thing for the legs. If both legs had normal power, you just write R stroke L for the normal. Oh no, I've written at the wrong place. So you write R stroke L for normal power, and then in that order basically. So all you do at the end of the day is to put your total together. For the GCS especially, you put the total together. So for the GCS, the spontaneous was 4, the eye opening was 4 because it was spontaneous, the verbal response was also 4 because the patient was confused, the patient did not get a 5. 5 is what well oriented. Obviously, we said our patient is not oriented, so that would give us 4. And then the best motor response is 6, okay, because the patient obeyed every command you were instructed. So 6 plus 4 plus 4 gives you what? 14. And the total GCS, the highest you can get is 15/15. So your patient's GCS, or the Glasgow Coma scale results will be what? 14 out of 15. All right, so just verbalize, okay, Akins, I've done your neuro assessment and everything. Just describe everything you have done, and then just tell him or her the results. Okay, so your GCS is 14/15, which is just an indication that you are a bit confused. Okay, but like I told you, I'm going to get your bed closer to the nurse's station so that we can closely monitor you. I mean, I'll constantly reorient you to time, place, and person. And then also, most importantly, I will be reassessing every 30 minutes. So that's the key thing. For GCS of 14, you are going to reassess the patient every 30 minutes until GCS comes back to 15/15. So that's a very, very key thing after you are given the education after your GCS. So basically, I think that is it. So I'll try and do a separate video doing the entire assessment on subdural hematoma, and then I'll let you guys know. But this is the few details that you need to do in addition to the checking of the vitals, the temperature, all those things that you already know about. And that's it. It's as easy as anything. If you have any question, just put in the comment section and I will be glad to respond. All right, thank you very much. Let me see if I can bring this closer so that you see it. So the GCS 14/15, and then I'll put my initials. Let me see if I can help you to see what I have done. Okay, I don't know if I've captured everything. That's it. Okay, bye guys.